how to do behavioral health, and not just how to assess for it as within the scope of a primary care physician, but how to interface with behavioral health providers, how to communicate with behavioral health team members, how to know when it's the right time, let's say, to do a warm handoff to a behavioral health team member. And so they learn in this environment as resident physicians too, because most of our practice, the bulk of our clinical care is provided by resident physicians alongside attendings, and so they get to learn how do you communicate with behavioral health and other providers. We have sometimes we have clinical pharmacy on site, and we have the clinical nutrition dietitian providers here that we're ramping up in our clinic to become integrated care providers as well.
I think we're also setting the stage on what a resident, a physician, a nurse practitioner, what they can expect from us.
Yes.
And if we can set that stage in a training environment, then when they go out, it's an automatic ask. In order to conduct quality delivery of medical care, there are going to be certain team members that they expect, and or at least maybe this is the first time another organization is having this conversation with someone, because now we have proven the value of having that integrated connection and that team working around and wrapping around that patient. So I think ultimately our tentacles extend pretty far and wide because of the nature of the training that goes on here. It becomes an expected feature, or at least a hoped for or asked for feature when they move on to another organization, for instance.